Hi, and welcome to How to Use Nutraceuticals with FSM for Pain Relief and Healing. This is Dr. Harlan Mateg. In this video is an add-on to a series of videos on how to relieve pain with Frequency Specific Microcurrent. I realized after making the first 3 videos in this series that I would be leaving out a big part of the solution for most people if I didn't talk about nutraceuticals for pain relief. So in this video, I'll show you how specific nutrients and nutraceuticals can dramatically improve your results in terms of healing and pain relief. The first 3 videos of this series focused on using FSM to relieve each of the 3 types of pain. There is one video on each of the types of pain. You'll remember that the 3 types of pain are nociceptive, neuropathic, and nociplastic. Nociceptive pain is pain from injured or damaged tissue. Neuropathic pain is from any nerve that is damaged or injured, and this can be from a nerve damage by traumatic mechanical injury, from infection, or even from toxins. And finally, nociplastic pain is caused by a dysfunction of the brain and spinal cord that causes abnormal amplification of pain signals from the body. And this typically can begin after about 3 months when the pain becomes chronic. To clarify the different types of pain even further, let's look at this graphic. The first type of pain is associated with tissue injury. You see a lighted match being held next to the skin. This would certainly cause a burn or injury to the skin and pain. This injury or an injury could be anything like a muscle strain in the back while bending over. It could be the irritation of a tendon while golfing, as in golfer's elbow. It could be a whiplash injury to the neck in a car accident. All of these injuries will elicit pain. Here the oval is around the nerve that carries the pain message from the injury site to the spinal cord. Damage to our peripheral nerves by mechanical injury, by infection, or by toxins can cause nerve pain and other symptoms. We call this type of pain neuropathic pain. Diabetic neuropathy, small fiber neuropathy, Bell's palsy, trigeminal neuralgia, shingles, carpal tunnel syndrome, and sciatica are all examples of neuropathies. Finally, we have the central nervous system consisting of the spinal cord and brain. Pain signals travel up the spinal cord to the brain, where we experience the signals as pain. When injury pain or nerve pain lasts for more than 3 months, we classify it as chronic. And sometimes chronic pain causes the central nervous system to dysfunction. Essentially, the central nervous system loses its ability to filter out or dampen the incoming pain signals. And as a result, the experience of pain is magnified. Sometimes this happens even after the initial injury has healed. The injury has healed, but the pain continues at a magnified intensity due to the dysfunction of the central nervous system. It is well established through research and clinical experience that FSM can effectively relieve injury-related pain. It relieves this pain by accelerating the healing of injuries. It also effectively relieves nerve pain. And finally, it has been shown to alleviate pain associated with centralized pain syndromes. So we know that FSM is very effective at relieving all the different types of pain. But the question is, can we improve on these results even more? Remember that most of the time, pain is the body's warning signal that a tissue is suffering or has suffered damage. With respect to injury-related pain and neuropathies, the pain goes away once the damage is healed. In the healing process, As your body tries to repair an area of damage or of injury, it must have specific nutrients to do so. Without these nutrients, the healing process is interrupted. And even if you're generally well nourished, the body's nutritional needs goes up significantly whenever it is attempting to repair damage and heal an area. As an analogy, think of a house that has been damaged by a storm. Repairing this house will require new shingles, gutters, and siding. Frequency Specific Microcurrent is like a construction boss who directs the repairs. Like a good construction boss, FSM organizes and speeds up the remodeling process and makes sure that the repairs are done right. But without the necessary construction materials, the repairs are not going to get done. In other words, FSM will work a lot better when there are the right nutrients available to do the repairs. Now let's look at the nutrients that help a body to repair an injury. While this might change a bit depending on what tissue is injured, there are some critical nutrients that we need with all tissue repair. Here's a list of the nutrients that our body needs to repair damaged tissue. All of these nutrients are involved in tissue repair. Whether the tissue damage is from an injury or from surgery, these are the nutrients that the body uses to rebuild tissue. When these nutrients are all in good supply, our body will heal an injury faster and more completely. As an aside, it's far better to take a product that has all of the nutrients in correct proportions than to try and take single nutrients by themselves. There is a mix of nutrients and nutraceuticals that have been shown to relieve chronic joint pain due to osteoarthritis. Here are the ones that have the best research behind them. These are specifically for chronic joint pain due to osteoarthritis. Osteoarthritis is arthritis associated with wear and tear of the joints. A main cause of pain in the body is inflammation. Whenever there is an injury to our body, to our tissues, our body responds with inflammation. And inflammation is part of the body's healing process. Here's what the healing process for any injured tissue looks like. On the left of the slide, you see a blood vessel that is damaged, either by injury or by infection. In either case, if you follow the arrow pointing to the right, this results in acute inflammation. On the bottom of the slide, you see injury progressing to repair process, which is the inflammation. After inflammation, continuing to the right, is resolution. By resolution, we mean complete healing of the injured tissue. Resolution is the ideal outcome and return to physiological health. There is a very important class of anti-inflammatory nutrients whose function is to resolve or end the inflammatory process after the tissue is repaired. As you no doubt know, this group of nutrients is the omega-3 fatty acids. Just as the gold arrow shows, omega-3 fatty acids help to push the repair process to full resolution so that the inflammation and any lingering pain is resolved. I made the arrow gold because the best source of omega-3 fatty acids is fish oil, which has a gold color. The oil of cold water fish contain high amounts of omega-3 fatty acids. Omega-3 fatty acids are the body's own anti-inflammatory. They are classified as, quote, essential, meaning our body needs them but cannot make them on its own. So we have to get them in our diet. There are many research studies showing the pain-relieving benefits of omega-3 fatty acids. Here are 4 studies that show how consuming higher levels of omega-3 fatty acids relieves joint pain, lowers the risk of pain from any cause, and reduces vertebral disc-related pain. Many people fail to benefit from taking omega-3 fatty acids because they don't take enough. Explaining all the nuances of taking omega-3 fatty acids would take a complete presentation of its own. To summarize, though, I recommend taking an omega-3 manufactured by a professional supplier. That is, a company that sells to health providers. That is the easiest way to assure yourself a good product and to make sure you're not taking something that might damage your health. I'll provide a link to some of the professional suppliers that I trust at the end of this video. Remember that when buying fish oil, you get what you pay for, and you don't want to be taking a cheap fish oil. With regard to dose, if you suffer acute pain, take 3,200 milligrams of EPA and DHA daily. EPA and DHA are two types of omega-3 fatty acids that will always be shown on the label of a decent fish oil product. A good maintenance dose is 1,500 milligrams of EPA plus DHA daily. It's best to test your omega-3 level to know what your level is. This gives better guidance for dosing in the long run. There are several well-researched herbs that have proven significant anti-inflammatory properties. 3 of the most effective are curcumin, ginger root, and boswellia. If you've been taking an NSAID drug for pain relief, it makes sense to consider switching to an herbal combination like this one or with these herbs so that you avoid the side effects of the NSAID drugs, which can be formidable. For most people, herbal combinations like this have no side effects and provide significant pain relief. On the right of the picture is a turmeric plant and also the turmeric root from which curcuminoids are extracted. In the top right of the picture is the chemical formula for 2 of these curcuminoids. These are the molecules in the plant that have been shown to have the potent anti-inflammatory and health-promoting benefits. So far, we've been talking about remedies, nutraceuticals, and nutrients for relieving pain that's associated with tissue injury. Now let's look at pain remedies for neuropathic pain. There are 2 groups of remedies for neuropathy and nerve pain. First are the nutrients. By definition, a nutrient is a substance that provides nourishment that is essential for growth and maintenance of life. In this case, we're talking about the growth and maintenance of healthy nerves. When a nerve is injured or damaged in any way, whether by toxins or infection, the nerve requires more of the nutrients that it normally relies on to maintain health. The next group of remedies for neuropathy and nerve pain is the nutraceuticals. Nutraceuticals are substances found in nature that provide medical and health benefits. Again, in this case, we're talking about chemicals in nature that benefit injured or damaged or inflamed and painful nerves. Here's a list of nutrients that are critical for nerve function and which have been shown to relieve nerve pain or improve neuropathies. There are other nutrients as well, but these are the most critical. On the bottom right is someone who is trying to figure out which of these nutrients to try: nutrient A, nutrient B, or nutrient C. I would tell them to get a multiple ingredient product that includes most, if not all, of these ingredients or nutrients. Consider it as your multiple for your nerves and take it as long as you continue to have a nerve condition. Nutraceuticals for nerve function and pain relief. Sometimes there isn't a clean distinction or boundary between nutrients and nutraceuticals. Alpha-lipoic acid and N-acetylcysteine are nutrients that benefit nerve health. And at larger doses, these 2 nutrients have more of a nutraceutical effect. They become like natural medicines or drugs, but without the side effects of drugs. So you'll find alpha-lipoic acid and N-acetylcysteine available as single ingredients with recommendations for taking them at higher doses. Let's look more closely at alpha-lipoic acid. There are many research studies documenting the benefits of alpha-lipoic acid for neuropathy. The study on the left is typical. It concludes that, based on the currently available evidence, at a dosage of 600 milligrams once daily over a period of 3 weeks, alpha-lipoic acid leads to a significant and clinically relevant reduction in neuropathic pain. Then let's look at the study on the right. The authors of this study conclude that the antioxidant properties of alpha-lipoic acid endorse its potential for the treatment of neuropathic pain. Clinical studies corroborate the analgesic effects of alpha-lipoic acid by antioxidant mechanisms in patients with painful diabetic neuropathy, neuropathic pain associated with multiple sclerosis, diabetic sensory motor polyneuropathy, and chronic lumbosacral radicular pain. N-acetylcysteine is another nutraceutical that helps neuropathies. In the study on the left, the authors conclude high-dose NAC, or N-acetylcysteine, administered for 12 weeks, modulated inflammation and improved clinical outcomes of diabetic peripheral neuropathy, reflected by a decline in neuropathy and pain scores and an improvement in quality of life. In the study on the right, the authors say, quote, over a time period of 8 weeks, adjuvant N-acetylcysteine is more efficacious in improving neuropathic pain associated with diabetic neuropathy than placebo. In plain English, in both of these studies, the researchers are saying this stuff works. Now let's talk about curcumin. Curcumin is actually a group of compounds called curcuminoids that are found in the spice turmeric. Collectively, they're called curcumin. On the right is a research study that was published in the medical journal Antioxidants. The study is titled Key Developments in the Potential of Curcumin for the Treatment of Peripheral Neuropathy. This graphic is out of this research study. It shows all of the different places that curcumin has been found to benefit peripheral nerves, the spinal cord, and even the muscles innervated by nerves. If you look at the bottom left, you find a curcumin molecule with arrows pointing to the nerve cell body in the spinal cord and the nerve fiber going out to the muscle. This is what is called a motor nerve. Underneath is a small box listing the benefits that research has shown for curcumin. Curcumin improves motor nerve conduction velocity. It prevents demyelination of the nerve, or destruction of the insulation of the nerve. It prevents loss of motor nerves and finally increases the regrowth of nerve fibers. Now let's look at the curcumin molecule on the top right center of the slide. In the box are the benefits curcumin has for sensory nerves, the nerves that carry the sensation of pain. Curcumin decreases pain and hypersensitivity of nerves. Curcumin improves the survival of sensory nerves and improves the ability of sensory nerves to regrow. Here are the conclusions made by the authors of this study. Quote, curcumin, because of its anti-inflammatory, antioxidant, and anti-ER stress and neuroprotective properties, is the perfect candidate for treatment of peripheral neuropathy. End quote. Because of its numerous biological properties, curcumin reduces tissue damage or improves tissue repair of nerve, muscle, and dorsal root ganglion, which is part of the nerve, in many peripheral neuropathies. These effects are also reflected at the behavioral level by reducing the signs of pain, improving sensory and motor recovery. So curcumin can be a big player in terms of relief of pain associated with peripheral neuropathy and recovery from peripheral neuropathy. The reason people sometimes don't get results with curcumin is twofold. First, they don't actually get enough of the active curcuminoids, and most often that's because of the product that they're taking. You want to make sure to be taking 1,500 milligrams of curcuminoids in divided doses through the day. And you want to make sure that the curcumin brand that you're taking is 95% concentrated in curcuminoids. Curcuminoids are the active ingredient, and you want them to be concentrated. Then second, make sure that the curcumin has been processed in a way to increase the absorption. Normally by itself, curcumin is very poorly absorbed, but over the years, several technologies have evolved to increase its absorption dramatically. For instance, studies show that theracumin is absorbed 30 times better than normal curcumin. Meriva is absorbed 29 times better, and BCM 95 is absorbed 7 times better. So make sure that you're taking one of these enhanced absorption formulas. With reference to alpha-lipoic acid and N-acetylcysteine, here are some guidelines as to how much to take daily based on what the research studies are showing. So alpha-lipoic acid, 600 to 1,800 milligrams daily in divided doses, N-acetylcysteine, 600 to 1,200 milligrams daily in divided doses. There is a nutraceutical called PEA that has been shown to benefit all three of the pain categories. So it helps all types of pain. It lessens nociceptive, neuropathic, and centralized pain. PEA is an abbreviation for palmitoethanolamide. Here's a representation of the PEA molecule. PEA is found in our body normally. It's produced by many cells in our body and is found in virtually all body tissues, with very high concentrations in brain tissue. It is also found in some foods, such as egg yolk, peanut flour, soybean oil, and corn. Let's quickly look at some of the research on PEA. This study is entitled Effects of PEA on Neurodegenerative Diseases, a review from rodents to humans. The researchers concluded that the main actions or functions of PEA were neuroprotective, anti-inflammatory, and analgesic, meaning analgesic means pain relieving. The areas of benefit were many pain conditions, including fibromyalgia, osteoarthritis, which is pain caused by wear and tear or degeneration of joints, degenerative neuropathies such as diabetic neuropathy, multiple sclerosis, and compressive neuropathies such as sciatica and carpal tunnel syndrome. Here's another study on PEA. It's titled Palmitoyl-ethanolamide, a nutraceutical in nerve compression syndromes, efficacy and safety in sciatic pain and carpal tunnel syndrome. This was a study of 636 men and women aged 19 to 72. All of the participants were diagnosed with sciatica or carpal tunnel syndrome. They all reported pain levels at 5 or above on the 10-point visual analog scale. The participants were randomly divided into 3 groups, and the groups received either a placebo, 300 milligrams of PEA, or 600 milligrams of PEA daily for 3 weeks. The group that took 600 milligrams of PEA daily reported a 60 to 70% reduction in pain after 3 weeks. Like curcumin, PEA in its pure form is not absorbed well through the gut wall. When you look for a PEA product, you need to make sure that the PEA has been modified in some way to improve its absorption. Creating microscopic bits of PEA and coating them with fat increases their absorption significantly. PEA that has been processed in this way is called liposomal PEA. Another process for increasing the absorption of PEA is mixing it with a plant-derived substance, which has the trade name of gamma-sorb. Adding gamma-sorb to PEA is reported to increase absorption of the PEA 8 times, or 800%. When you take PEA, you want to take it 30 minutes before or 2 hours after eating, because this also increases its absorption. How much PEA should you take? This is the study that I showed you a couple of slides ago on PEA relieving sciatica. One of the authors is Professor Jan Keppel-Hesselink. Professor Hesselink recommends this dosing of PEA. You start by taking 1,200 milligrams in divided doses daily and do this for 1 month. If you experience significant relief during that month, then continue the same dose level for 2 more months. If you have not experienced a significant amount of relief after 1 month, then increase the dose to 2,400 milligrams per day in divided doses. This is double the amount. Most people will begin to experience pain relief within 3 weeks of taking this higher dose. Then continue taking the higher dose for months 2 and 3. After taking PEA and getting significant pain relief for 3 months, you can try lowering the dose. At that point, you test to see how low of a dose will maintain the same level of relief. If you have not gotten significant relief after 3 months of taking PEA, then it's probably not going to help you, so you can stop taking it. The last type of pain is centralized pain, or what we call central pain syndrome. The same nutraceuticals that have been shown to relieve nerve pain or neuropathies also, generally speaking, help centralize pain. Here are the nutrients and nutraceuticals that benefit centralized pain. I just talked about PEA, and earlier I talked about omega-3 fatty acids. Curcumin has been shown to help relieve both nerve pain and centralized pain syndromes. Vitamin C lessens the risk of developing chronic regional pain syndrome, or CRPS, that usually occurs after a surgery or injury. And vitamin C has also been shown to improve CRPS. Finally, vitamin D deficiencies are associated with chronic pain syndromes, and so supplementing vitamin D is also recommended. A question I often get from patients is, how many of these supplements should I take? And I'll just tell you how I think about it. Inflammation and chronic pain are like a big fire that's out of control. Chronic pain wreaks havoc on our health. One study showed a 12% loss of gray matter in the brain of people who suffered a year of chronic low back pain. So you really want to do everything that you can to relieve your pain. When people ask how many of these different pain supplements should they take, my answer is enough to put out the fire. That is, enough to get rid of the pain. When firemen go to put out a fire, they use as many hoses as they can to put out the fire as quickly as they can. If it's a small fire, 1 hose may be enough to do the job. For bigger fires, more hoses are needed. Let me go through a couple of hypothetical cases of chronic pain so that you get a sense of how to stack nutrients and nutraceuticals for maximum benefit. Take someone who has been experiencing chronic pain for 9 months. Let's say it started gradually without a specific injury, although they did injure their knee a number of years ago playing basketball. It seemed to heal okay back a number of years ago after the initial injury, but then they noticed that it seemed weak. If they did too much, it would get sore, and then after resting, it would get better again. And this pattern continued for a number of years, until it became fairly constant aching pain for the last 8 or 9 months. What would you take as far as nutrients and nutraceuticals in addition to using frequency specific microcurrent? Since it's clearly a joint problem, I would start with the nutrients for chronic joint pain. I showed you a slide of these nutrients towards the beginning of this presentation. These nutrients will help reduce inflammation and swelling in the joint and will support complete healing of the joint. Adding omega-3 fatty acids will support the body's overall ability to resolve and end inflammatory processes. Omega-3 fatty acids will benefit cardiovascular, immune, and brain health as well. Then I would add a 3-month course of PEA. This will help to break the chronic pain cycle to the extent that there has been a disruption of the central nervous system's ability to dampen pain stimuli coming in from the body. If after a month I didn't experience significant relief of knee pain, I would do 2 things. First, I would increase the dose of PEA, and second, I would add curcumin to what I was already taking because of its pain-relieving, anti-inflammatory properties. So that's how I would address chronic knee pain, along with treating the knee daily with FSM. Essentially then, you're creating a stack of nutrients and nutraceuticals to provide for all of your body's nutritional needs as it resolves the chronic knee pain. At the bottom of the stack are the nutrients required for healing the joint. Above it are omega-3 fatty acids. Which are anti-inflammatory body-wide. Above that is the nutraceutical PEA, which relieves pain and has other benefits. Then, if needed, is the nutraceutical curcumin, which is also anti-inflammatory. It's important to note that taking a stack like this has a multiplying effect. The joint pain nutrients, glucosamine and chondroitin sulfate, are anti-inflammatory. Omega-3 fatty acids, PEA, and curcumin are also anti-inflammatory, but they each work in different ways. They have different mechanisms, so they aren't duplicating each other's effect. The result is additive or multiplying. And the strategy is to add enough to the stack to get the desired relief. Then, too, you're combining the nutrient stack with a stack of FSM protocols that support the healing process energetically. So you might use an extremity joint protocol for chronic arthritis, a myofascial pain protocol, a protocol to remove scar tissue, and the concussion protocol. It's when you combine these 2 stacks, the stack of FSM protocols and the nutrient nutraceutical stack, that you get the best results. Let's look at how you might stack FSM and nutrients and nutraceuticals to treat a neuropathy like carpal tunnel syndrome. On the FSM side, you would use protocols like carpal tunnel syndrome protocol, the nerve pain protocol, the nerve fascia adhesions protocol, and the concussion protocol. On the nutrients and nutraceutical side, you would use tissue repair nutrients, particularly nutrients for nerves, like vitamin B12 and B6. You would take omega-3 fatty acids for their anti-inflammatory benefits, and then alpha-lipoic acid, PEA, and curcumin have also been shown to significantly improve nerve function and decrease nerve pain. You would increase or decrease the number of items in each stack depending on the severity of your carpal tunnel symptoms. Chronic regional pain syndrome is a neuropathy that has centralized components as well as peripheral components. On the FSM side, you would use protocols like the CRPS cold-dry protocol number 1 and number 2, and the CRPS central pain amplification protocol, the spinal cord inflammation protocol, and the concussion protocol. On the nutrients and nutraceutical side, you would take vitamins B1, B6, B12, vitamins C and D, and magnesium malate or magnesium glycinate. You would also take omega-3 fatty acids for their anti-inflammatory benefits, and then specifically for the nerves, you would add alpha-lipoic acid and acetylcysteine and PEA. I hope that I've been able to show you how using nutrients and nutraceuticals with FSM will improve your results. All you have to do is figure out which FSM protocols and which nutrients and nutraceuticals to take based on the type of pain that you are experiencing. The purpose of this video has been to show you how to use FSM with nutrients and nutraceuticals to get the absolute best healing and pain relief possible. But I want to add one thing. I'd like to give you a word of caution regarding buying supplements. There have been a number of studies of major brand supplements that you would typically find in retail stores. These were major brands that you would assume had some level of quality control on their products. The studies showed that most of the supplements that were evaluated either didn't contain what was on the label or contained only a fraction of what was claimed on the label. The bottom line is I only recommend supplements from professional suppliers. These are supplements that are sold to health professionals and are held to a very high standard of quality control. With these supplements, you are assured that you're getting what is on the label and nothing more, and that the ingredients are free from toxins. Fullscript is an online dispensary of professionally branded supplements. Somewhere on the page here where this video is embedded, you'll find a link to Fullscript. Using the link will give you a 15% lifetime discount for everything sold on Fullscript. Somewhere on this page, you'll also find a link to a page that I created that has specific supplements that I recommend that satisfy all of the criteria in this video. I hope you'll apply the information you've learned here. After all, nothing changes unless you act on what you've learned. If you have any questions about the information in this video, please feel free to contact me. You'll find contact information on this page. And thank you for watching. I wish you healing and relief.